So I think the most important thing is that we have to be very well trained in detecting the early onset of these two adverse events. That is done by training the physicians as well as the nursing staff, and then to follow algorithms how to intervene very early onwards to prevent patients coming down with more severe forms of cytokine release syndrome or neurotoxicity. For cytokine release syndrome, it's a combination of using predominantly dexamethasone with tocilizumab, an anti-IL-6 receptor antagonist, in sort of treating patients with cytokine release syndrome. And there's an algorithm being developed that you use at the beginning just one dose of tocilizumab, and if cytokine release syndrome becomes more severe, grade 2 or grade 3, that you give up to 4 doses. And also the amount of dexamethasone that you would give to the patient is increased over time as the patient has more severe symptoms of cytokine release syndrome in that context. The other one is that you have to work very closely to the ICU, because at stage 3, patients have to be transferred. So the ICU physicians have to know exactly what the symptoms are, how do you treat them, and what is the best supportive care in that context. I think the cytokine release syndrome, that's pretty straightforward. What is causing it? It is the T cells that are activated, because there's a very clear correlation between the severity of cytokine release syndrome and the initial expansion of the CAR T cells in the patients. And as the T cells are sort of producing cytokines when they are activated, that makes a lot of sense, that's true. Yet, what we don't understand is to which degree do other cells, other immune cells contribute to the severity of cytokine release syndrome. Hence, B cells, monocytes, macrophages, or granulocytes in that context. In terms of neurotoxicity, I think there is a lot of evidence out there that is caused also by cytokines. I think it's highlighted by recent papers last year that IL-1 pathway seems to be very important, and is to be seen if blocking that pathway, so with IL-1 receptor antagonists or agonists, if that's going to help us to actually treat patients with severe neurotoxicity.